Hello everyone, this is Meghna and in today's video we're going to learn about first aid. So, are you ready for that? Let's get started. Yeah, so we we're going to start first aid. What is the first aid? The best way to avoid all accidents is to be careful and follow safety rules. However, when an accident takes place, the injured person needs help. The help given to an injured person before a doctor can see her or him is called a first aid. Let us learn some ways of dealing with minor injuries and providing first aid to the injured. So, so what's our first? Yeah, our first is fractures. A crack or a break in a bone is called as a fracture. Okay. What must we do when a fracture is occurred? Make sure the affected limb is in a natural position and is kept still. Use a sling made of cloth to support the fractured arm. You can also use a splint to keep the affected limb still and straight. And you can make a splint from anything firm such as rolled up newspapers or magazines or a piece of cardboard. The splint must extend above and beyond the broken bone. Cushion the splint with cotton wool or a soft piece of cloth. Okay. Next is sprains. Sprains occur when we injure the ligaments and at their joints. A sprain is usually very painful and leads to swelling. Never massage the sprained area. It may lead to a fracture. Okay, so I'll repeat it for you. Never massage a sprained area. It may lead to a fracture. Okay, now do not move the affected part. Put ice packs on the affected part to bring down the swelling. Wrap a crepe bandage out around the joint. Next is minor wounds. A cut or a scratch can result in a minor wound. A wound is an opening in the skin through which germs can easily enter the body. Minor wounds can be treated at home by following these guidelines. Wash the wound thoroughly with mild soap and water. Dry it using a cotton wool or a gauze. Apply an antiseptic lotion. Put a clean bandage such that it does not stick to the wound. If the wound is bleeding, place a gauze pad tightly on it to stop the bleeding. Okay, so our next is animal bites. Bites and scratches of animals can be very painful. Wash the wound immediately with soap and running water. Apply an antiseptic lotion on the wound and cover it with a clean cloth. Bites of some animals, such as dogs and monkeys, can cause a dangerous disease called rabies. Visit a doctor to find out any anti-rabies injections find out if any anti-rabies injections are necessary. Okay? Yeah. Next is snake bite. Okay. So, all snakes are not poisonous, but the bite of a poisonous snake can be very dangerous. Most snake bites can be treated if the victim receives treatment at the earliest. If someone is bitten by a snake, keep the person calm and do not allow the victim to walk. And okay, so over here, victim means what are we saying? Victim means a person who is bitten by the snake. Okay, if not this, you can say as a patient. Okay, now keep the affected limb below the heart level to reduce the flow of venom. Bandage the Bandage the affected limb by using a bandage or a piece of cloth. Make the bandage tight, but not too tight. Use a splint to make the affected part still. Never try to suck out the venom by mouth. This is important over here, that never try to suck out the venom by mouth. So here we go, and we start with the nose. We start with the nosebleed. Sit. Okay. So when nose is bleeding, your nose. So now sit straight with your head tilted slightly forward. Do not allow. Do not lean back or tilt the head backwards. Okay. Pinch the tip of the nose with your thumb and index finger for at least 10 minutes. What is over here? The pinch means what? The pinch means at the top, at this point. Okay? Breathe through your mouth. If the bleeding does not stop, apply pressure for another 5 minutes. You can also apply an ice pack on the nose to stop bleeding. Do not blow or pick up your nose for a few hours. Okay? We'll go with the next. Yeah. Next is minor burns. Okay. Now, in minor burns, okay, fire and hot things can cause burns. Hot water or steam often cause burns. Okay. Now, keep the burns area under cool water for at least 5 minutes. Burning often leads to the formation of blisters on the skin. Do not prick them. An open blister can get infected. Apply aloe vera gel or an antibiotic ointment over the burnt area. Cover the burn lightly with a gauze bandage. Now, over here, the word blister. What does it mean? Blister means what we can say as blister means a swollen area which is filled with liquid. Okay. Many times it happens when something we're touching something hot, and then again we just take our hands back, and then after some time we feel that there is a blister, and that blister looks something like white. Okay. Uh, yeah. Now, fainting. Fainting is a temporary loss of consciousness. It occurs when sufficient blood does not reach the brain. Fainting can occur due to various reasons, such as uh, being hungry for a long time, being tired, or being exposed to the sun for a long time. Okay, now what can we do? Okay, if a person faints, make her or him lie down with feet slightly elevated. Okay, loosen any tight clothing to make the surroundings well ventilated. The fainting spell should pass away in a minute or two. If the person remains unconscious for more than 2 or 3 minutes, call a doctor immediately. Okay, just yeah. The next is heat stroke. Okay, the heat strokes are caused by exposure to extreme heat and humidity. A heat stroke causes a person to lose a lot of water and minerals from the body, resulting in dehydration. The person develops a severe headache, dizziness, and may have very high fever. Okay, an important first aid for heat stroke is to keep the person's body cool. Next, now, what can we say? What is the first aid for heat stroke? Make the person lie down in a shady and cool place with feet slightly elevated. Apply cool water over the body. You can put ice packs on head, neck, and under armpits. Fan the person to lower the body temperature. If conscious, give the person water or ORS to drink. Okay, ORS full form is oral rehydration solution. Okay, and ORS is a solution of water with small amounts of sugar and salt. Okay, yeah, we will go to the next slide. Yeah, so over here, um, we have the we have some of the pictures for you. I have kept these. Okay, so you must be if you are not knowing what is the meaning of elevate feet or sling or splint. Blister, many people know because this happens most of the times when we get burned. Blister happens. So I have some pictures called as this is a splint. Okay, as I told you, this is a splint. If you want to make a splint from cardboard or what you can do, you can make the shape of your finger if you have an injury in finger or a hand if you have injury in hand. And then what you can do, add some ropes to it. And from the ropes, just keep your hand inside and that's your splint. And the cardboard must be 2 to 3 layers. Okay, now this is a sling. Sling means many times we use this sling when we get fractures, and this is the picture of an elevated feet. Now, how do we do? When we have to elevate feet, you can put pillows or some wooden blocks. Okay, but in elevate feet, do not keep your feet like this straight, but you may keep your feet like this. See, like this you have to keep this position, this and this position. You must keep your elevated feet. Over here also in the picture, in yes you can see they have the posture is 1 and 2, but in no the posture is straight. Okay, now I'll just go to the okay now thanks for watching my video. Okay, uh, yeah. So now over here, I wanted to tell you that if sometimes if the fire catches your cloth, what must you do? This is an important thing that at that place you must stop, and then what you can do, you just drop on the floor, and then hands covering your this part or covering your face, you can see you have to roll over the floor. Okay, and this way you can just leave that fire from your clothes. And I'll repeat: stop at the place wherever you are, and from that place you just have to drop down on the floor. Means how you have to drop? Not like this straight, but you have to drop like this. Okay, and while you drop, after that, just keep your hands on face, or you can just what do you say, like this, and cross you can keep so that this is keep tight, or you can do like this also, and roll over the floor like this. You can see roll. So you're gonna go like this, 3 to 4 times roll till the fire doesn't leave your clothes. Okay, I would show you the picture also, but sorry, I didn't show you. Okay, so thank you for watching my video and bye bye for today.